School-based health is really an interdisciplinary, really open approach to caring for children and adolescents and meeting them where they're at and addressing unmet health needs. One of the things that we do, whether we're just filling in a gap until we can get an uninsured client their insurance, we want to make sure that they're getting all the preventative medicine that they need and all the supports that they need. So with that, we want to make sure that anything that they're due for, they're getting. That includes immunizations, making sure they're fully immunized with HPV and flu and everything that we know is going to keep a child or adolescent healthy.
I believe that school-based health is access to physical and mental health services to adolescents right here at the school where they spend a lot of their time. I believe that it is also more than a school nurse, as we are almost a doctor's office that can provide resources and care. A lot of students are referred to me for concerns about overweight and obesity. That is one of the main referrals that I get. We do take a lot of measurements here, so height and weight, which calculates the kids' BMIs. And that is one of the big referral sources for me. We do not work with giving a diet plan or anything like that. It's a lot of lifestyle modifications with these kids. So we talk about healthy eating, physical activity in a way that is appropriate for them and that is realistic for them as well. A big part of our job is to do a full assessment with these kids. And we assess everything from what they typically eat, what is available at home, where maybe do they do some of their grocery shopping, so that we can get an idea for what is accessible to them. We work a lot with what's available here at the school. A lot of our kids are eating breakfast and lunch and maybe even an after-school snack here. So I work with them on, hey, well, when you're in the lunchroom, trying to pick out some of these different options, maybe choose that fruit, choose a veggie, try something different. And so we focus a lot on what is available to them. And when we talk about if they're going to the local gas station or the 7-Eleven or whatever it is, thinking about what is available there and what can they choose there that would be realistic.
School-based health is access, actually. Access for students and adolescents in the community. So not just the students at that site, but for any adolescent or person through the age of 21. Addressing things that they may be having struggles with. That includes behavior problems, that can include a diagnosis of maybe something like ADHD, or even losses that a lot of children in our community suffer. So you're addressing all those issues that may be causing difficulties for the children.
So the mobile unit goes to Genesee County. We have all of our sites in Genesee County. A student has to be seen at one of them first, but then once they're seen, they can be referred to us for either dental or vision services. We don't do any restorative dental, we do all preventative. So we do the cleanings, the sealants, the fluorides, and then if they need additional at that point, I work on getting them set up with a dentist or other places to get the restorative work done. And then for vision, we see them on the unit. We can figure out whatever their prescription is, and they order glasses right here on the unit, and then they're delivered within a couple of weeks.
The main benefit of our mobile unit at RAHS is that it's yet another way that we can bring services that are difficult to get to in the community to the school, to the student and the family at that school, and reaching out to the larger community as well. So that kids that really need glasses, that just haven't for any number of reasons been able to get to an optometrist or an ophthalmologist, a place where they can get evaluated, get glasses, have those glasses delivered to them at their school and on their faces so that they can see better and do better in school. Or kids that for any number of reasons can't get to a dental home, to have regular cleanings of their teeth, to have the opportunity to be linked to dental homes where they can get restorative work on their teeth done. When we have a mobile unit that can drive up to their school and bring them literally onto a really cool bus that has, just like you would be in your eye doctor's office or in your dentist's office, that kind of quality of care, it's amazing to be able to bring those services to those kids that couldn't get them otherwise. When I think about school-based health, I think about the opportunity to find kids where they're at. The community partners that RAHS works with are indispensable partners, and we wouldn't be able to do what we're doing without them. Some of those partners are also at Michigan Medicine. We're working very closely with the Kellogg Eye Center. Courtney Dewey is an optometrist in pediatric ophthalmology that works with us both on our mobile unit and in our brick and mortar vision center at Ypsilanti High School. We're working with the Mott Community Center, a FQHC pediatric care center in Flint, working with their mobile health dentistry group, which is also linked back to our dental school at Michigan Medicine, as well as other community organizations that are equally dedicated to improving the lives of kids and families in our community, whether that be food gatherers, working on distributing food to children that have families that have food insecurity, whether that be programs that we do in concert with local farmers markets, both in Flint and in Washtenaw County.
This program is tailored to their needs, and so it lets them know that people see them and care about them. We teach them advocacy for themselves and their mental health and their physical health, and also about their peers. So I feel like those are really important messages that they need to hear. So I love the aspect of having care coordination within the school-based health center because my role primarily is the clinical piece of it, where I'm providing the therapy and I'm teaching them skills for their own mental health. But we also encounter students who might have some tangible needs, where it may be around housing, it may be around food, it may be around transportation or medical care insurance. And because of the care coordination, we're able to provide a very comprehensive program that meets all of the different needs that our teens are encountering outside of the mental health piece of it.
So the unique part of school-based health is the opportunity for families and youth to take advantage of our services in the community. So typical services at the university are within an outpatient setting or within the institution, which are more forward-facing or inward-facing services. These services are more outward-facing, so that means if you're right here on our bus line, you can come to any of our school-based health centers. They're open to the community at large. So again, I think that for some students that may not have what some could say is a typical home life, and being able to have access to mental health services, it's something that we provide here. But also I know that there are some community partners and some major health systems that have major wait lists for patients to get in for these type of services. So again, we have several health centers that are strategically planted throughout the community, and so essentially if a patient is not able to get into one health center, they surely can get into another. The other component of that is in terms of confidential services. The state allows by law for patients to be able to minor consent for certain services, and so that's around the STI testing as well as mental health services. Because they're so strategically planted throughout the community, there's several opportunities for youth to take advantage of.